HE provided some pump priming money for workforce projects, and there was a long list of projects to work on.
I took the lead on recruiting the secondees, and there was the 7 strategic aims that we needed to focus on that related to workforce intelligence, tariff.
We also worked on preceptorship, return to practice,
international recruitment, apprentices, and then also our support workforce.
So we've got 10,000 employees working at this organisation, 8% of which are AHPs, so it's not an insignificant number.
Everyone's kind of starting from a different point with their workforce plans. So the point of the project was us to do a wide scoping across multiple aspects of workforce planning and get us to a point at which we can come up with a strategy for allied health professionals across all of our providers.
We want to look at various different ways to develop our workforce, recruit them, sustain them, invest in them. And we did, try to make that as inclusive as possible. So AHPs not just in the NHS, looking at those in social care. We had lots of registered staff from different organisations and lots of support workers from different organisations.
HE were great in providing support by giving us the webinars and training. They also had a dedicated email for the support staff and also set up private virtual meetings if you needed extra help and support.
We piloted a survey to get feedback from the support workers across the whole of BSW. We got an amazing response from that.
So that was basically to work out what their qualifications were, their experience, how happy they were, and that data would be used then to implement the framework going forwards. The support worker framework is all about making sure that support workers are educated and skilled enough to do their roles, as well as providing them with a framework, essentially, to progress in their roles. And once it's implemented, hopefully it will mean more interest for the support workers and, of course, better care for our patients. We've been able to have more conversations about how we support our international recruits. And international recruitment is a really key area at the moment.
So much has been done for medical and nursing recruitment from an international perspective. There was so much that we could learn from there. There were a number of people that were in support worker roles but were actually qualified registered professionals in their native country. It's having those conversations with those support workers and thinking actually we may be able to support you through the process of being registered within England as well.
Half of the support workers that were in the faculty for these projects have gone on to really evaluate where they're at in their careers and give them the confidence to take the next step.
People have got promotions. Like myself, I've gone on to do my occupational therapy degree apprenticeship.
Being brave from a finance sense is really difficult because we're not finance people. We've always been focused on cost saving rather than spending to save, and what we are able to do now is talk together and help everyone understand that actually spending money in this way is actually very impactful from a system perspective.
A really fantastic thing from this project actually is the collaboration across all of the different AHPs, working across the different organisations and learning from each other.
And there are people, maybe they work in a different team from you, but they're tackling the same issues. So why wouldn't we try and learn together?
The project's been an excellent way to facilitate our conversations within the organisation with our Director of Workforce and some of our senior managers. Everyone's very, very supportive of developing the AHP workforce, not only our supply, but how we're going to develop and retain our current workforce.
The outcomes so far and the injection of life that is given into the AHP workforce is really quite incredible. We've never ever discussed AHPs in this depth, with a real sense of the executive team understanding just how important these staff are.
We all left the project feeling like we'd made a difference.
Allied health professionals can deliver, and for the first time we've all felt like we can do that as one.
I think it gives AHPs a shared and collective voice and ambition to demonstrate their worth for the sustainability of health and social care going forwards.
By working as a system and increasing the quality of care and the quality of what we provide across our system, we're fundamentally helping that individual person have a better patient experience.
I think my key takeaway is that I'm not just one person on my own as a support worker. I'm part of this massive, wonderful and exciting group of people who are very, very important to the NHS.